This video is for educational and instructional purposes only. It should never be used as a substitute for professional medical consult, evaluation, and treatment. Please consult with a licensed medical practitioner before starting this or any other exercise program.
Hi, I'm Magda Boulay. I'm a physical therapist and I have my own practice here in Oakland, California, and it's called Pilates, Physical Therapy and Pilates. I named it Pilates because I'm a physical therapist, and so I do PT. I offer PT rehab for people with injuries, and if people just want to stay healthy and strong, I also offer Pilates wellness visits, and what I do in these cases for my clients is I take a look at their posture, strengths, weaknesses, and how they move. And when I find problems, I try to address them, and using the observations and Pilates techniques can often help remediate any postural issues that come up, which may be contributing to pain or dysfunction, or just poor movement in itself. So optimally, we want our body to be strong and nice and support the spine to be supported. What I want to do today is talk about the spine itself and the basic common things that can happen with the spine and why it's a problem, and what I or another physical therapist or Pilates practitioner can do to help look at these problems and why we want to fix them. So I just wanted to go over some basic postural spinal issues that can happen with that are common in most people. Most people don't have perfect spines. We all have things that we can fix. So what's great about my profession is that we can look at this and address it. And again, I'm not going to go into textbook postural dysfunctions like kyphosis, lordosis, or sway back or flat back, any of those overall body spinal postures, because they're really complicated. And I find that yes, a lot of people will fit a profile, but they will have things that are also different. They don't fit into the textbook definition of those postures, but they might have many major pieces of it and then have something else wrong. So what I wanted to do is break it down into spinal sections and talk about specifically certain things that can go wrong with each section. And then again, when we assess a person, what we do is we look at all of the sections, and then we see if that could be contributing to whatever problem the person is having, whether it's movement, pain, or dysfunction. And we try to give them exercises that will help correct those postural issues. So this is the spine, and again, this is a side view. You've got the back of the head here, the cranium. The first 7 vertebrae are the cervical vertebrae, which are in the neck. And then after that, both down below is the thoracic region. There's 12 thoracic vertebrae, and the ribs come off of that. So that's your main, that's where your rib cage is. Below the thoracic region, you have your lumbar spine, which is your lower back. There's 5 vertebrae there, and they join the sacrum or your tailbone here and your pelvis. So let me first talk about the lumbar spine. So again, the spine normally has a curvature. So there's a backward curvature both at the lumbar spine and at the cervical spine, and we call that a lordosis. Again, that's normal and natural. In between there, in the thoracic region, we have the opposite curvature, again, normal and natural to have a curvature there, called a kyphosis. And so it's got a little snake-like curvature, and that's where everything is in the mid-range. So again, your vertebrae are happy there. The joints in between them are happy. Ligaments and many different muscles that attach to them are also in their mid-range, and they are going to be able to function optimally there. If your spine does not fit that perfect pattern, which most people don't, sometimes it can lead to stresses on all of those structures surrounding it. So again, I'm breaking it down, and let's just talk about the lumbar spine, for instance. What I see a lot of is too much of a lordosis. So again, we want to have a curvature, we want everything to sit naturally, but again, if the spine is too extended, then what happens is it puts a lot of stress on the back of the vertebrae, and it also stretches all of these structures in the front, which can be a problem too. When you have too much of a lordosis, what happens is the joints in between the vertebrae will close down and they can rub, and so it can cause irritation. Over time, it can cause a bony buildup, as well as the joints closing down there. The foramina, or the windows that the little spinal nerves come out of behind your discs, they will also close down. They become smaller. When that happens, again, not enough space for those nerves to move around, everything to be happy. Sometimes there's an inflammatory reaction that can happen, or a compression on the nerve, which can lead to other issues, going to the muscles, or throughout your body, wherever those nerves are going. So we prefer to get that spine back into a more natural curvature and less of an extreme of a lordosis. Usually when someone comes in with that pattern, there are some typical things that tend to cause this. A lot of times your iliopsoas, your hip flexor, which attaches to the front of your spine and the inside of your pelvis, and it flexes your hips. Oftentimes that may be overactive or shortened, or too strong, and it could cause pulling of the back of the spine forward, and also sometimes a tilt with the pelvis. They usually go hand in hand, but not always. And then, as well as that, on the opposite side, you've got the glutes on the back of your pelvis here, which actually help secure that pelvis in a nice position. So typically, if you see a posture like this, that may be a problem that you want to look at too, is whether the glutes are functioning properly. As well as the iliopsoas, which is a huge culprit in that spinal dysfunction, and it can cause a lot of pain. You've got your abdominal walls in the front of your trunk, which support, that run from your pelvis up to the bottom rib. And so they also help support that natural curvature if they're strong. But if they aren't strong, if your deepest abdominal, your transverse abdominis, which helps stabilize your back, is weak, you won't have a strong support system through the core. As well as when you have the two layers of obliques on top of that postural muscle, those are they assist that overall core stability. When they are weak, basically the flexors don't let your body sit in that optimal position, and they actually kind of like they can just relax, kind of. Let's just say that. And when that happens, they don't contract properly. Again, the whole body in the front lengthens, and again, we kind of just hang on more of our static support, our ligamentous structures, things like that, and our joints. So again, what we want is to have a strong static and dynamic support system. We don't want to be stressing underneath our muscles. We want everything to be sitting in the proper place. Another reverse condition can be a flat back, or sometimes even an opposite curvature, and that's a big problem. Oftentimes that's just because some people are very, very mobile. They move a lot. Their pelvis moves a lot. All their whole joints move a lot, and their overall core muscles may not be strong enough. That transverse abdominis that I mentioned, that wraps around your body like a big corset and helps stabilize your lumbar spine in every different direction, that that can be very weak, causing people, when they just sit, they just flex, and they just habitually sit into a flexed position. And so again, hanging on all of those static supports, and that can be very, very stressful. As well as having some, in that condition, for instance, it can also lead to pressure on the back of the disc. So again, if you compress the front of the disc, the gelatinous substance in the middle of the disc can be pushed backwards, and it can be pushed backwards into these little spinal nerves, again causing all sorts of dysfunction. So we want, again, everything to be mid-range and no compression or any kinds of distraction one way or another, so that the muscles and joints can function optimally. Up along to the thoracic region, you've got that normal kyphosis. What happens when sometimes we don't have those postural muscles that are strong, maybe our erector spinae, which helps support our body upright, as well as that deep core muscles. If those aren't strong, we tend to slouch. There's other factors that come into play, but that's a basic concept to know. And when we do that, again, it causes our spine to curve too much, and we call that too much of a kyphosis, so excessive kyphosis. And this is a real problem. As an aside, when we have an excessive kyphosis, a lot of times we'll see in a pattern too much of a lordosis and then a compensation with the kyphosis, so a person might have both. Not necessarily, but again, that is a pattern, and if someone came in with that, we would want to address both problems. Back to this kyphosis though, what happens if we habitually sit in a slouched position? Over time, it puts a lot of pressure on the front of these vertebrae and these discs. If a person is susceptible to low bone density, that pressure over time, even without a trauma, can cause the front of your vertebrae to collapse into a wedge-shaped compression fracture, just spontaneously. If you're older and you have that much of a problem with the bone density, when that happens, that wedge-shaped vertebrae it can heal, but it will heal in a wedge-shaped vertebrae, which will cause more of a problem with that flexed position. Once you have that, then again, it kind of stresses more and more and more. So again, what we want to do is, if people have these muscular imbalances where they're just weak and they can sit upright because it's just a muscular problem, then what we want to do is try to get those issues early, get the support system we need to hold the body upright without a lot of work, because once your muscles are strong enough to hold your body in a more optimal position, it won't feel like a lot of work. But if you don't have the muscular support, when you first see, oh yes, I like to slump forward, you will try to sit upright, and you may feel like it's a lot of work for your erector spinae or some of your other postural muscles here. So this is something we want to work on over time. We want to figure out the problem, and then over time work towards getting a stronger support system so that we can fix it before it becomes a structural or bony problem. I already talked about how when there's a forward flexion of the spine, it could cause problems with discs, again, as well as having a susceptibility. There could be something along that lines going on too, just because of the mechanics of that flexion. So another reason why to get people more upright, we want everything to be in that mid-range normal curvature. That's where your muscles like to work too. If your muscles aren't functioning in their mid-range, if they're stretched or if they're too shortened on one side, then they're always going to be overworking. And when that happens, it leads to spasms, and it can cause overuse, strains. And so you can see how these things would cause all sorts of things all over the body. Going into the cervical spine again, most people have some habitual problems kind of slumping forward. Um, when that happens, sometimes the head goes forward. The head weighs a lot of weight. It's heavy. It weighs 7 to 10 pounds, maybe more, depending on the person. And with a heavy head like this, the gravity's effects are pulling that head downward. You're already in a subpar position for your joints, and all of your erector spinae here are having to hold your head and your neck, your whole body up against, they're trying to support the body against that pull of gravity. So it's very stressful for, in particular, the neck to have a forward head, sometimes as a result of a kyphosis in the thoracic spine, yes, so we'll just keep it like that. So what we want to do is get that spine up in a better posture, and when we do that, the cervical region oftentimes follows. Again, forward head, it leads to all sorts of muscle imbalances. People overuse all of their accessory muscles of their head. They will tend to have like a little bit of extension in their upper cervical spine. They have tightness here. They're weak in the front. You've got some stabilizing muscles in the front of your spine, which help support your head in an optimal position. And when you're forward like that, this will get tight. It can lead to headaches, and this habitually is weak. And so people will tend to jut their head out. Again, everything is not in an optimal position. What we want is for the neck muscles, the deep neck cervical flexors, to become stronger, this to be in a better position, not shortened, so that might need to be kind of worked on over time to get that balance, and for us to generally use those postural stabilizers. So that's what we do a lot of times in physical therapy rehab. People come in with these dysfunctions, and usually it's it can be a result of a trauma, obviously, and we would address that with manual therapy. There's different hands-on techniques that we can help get people better, and so of course I love to use that to help people speed up their recovery. And generally, we have lots of techniques to do that. So we would use whatever technique we found to be appropriate for what we found. And then we also want to look at why did they have an injury. Again, a trauma is pretty obvious, but sometimes it might be a chronic injury, and oftentimes with chronic injuries, it's something that's been going on for a long time. Bad movement patterns, poor habits, weak muscles on one side of the joint, tight, strong muscles on the other side. Again, these are all generalizations, but a lot of times imbalances in the joint. There's a shortened muscle or overactive muscle on one side, and on the other side, maybe they're weaker, and they may be in slack on the other side. So again, we would look at these imbalances and try to fix them. As well as those imbalances, I touched on it a little bit, but I didn't specifically talk about it because I was kind of just talking more about like what things could happen with the spine. Is those deep stabilizing muscles. The transverse abdominis is the deepest abdominal muscle, and it's critical in helping support an upright trunk and spinal posture, as well as those neck flexors that I touched on. And so most people, the postural muscles in their bodies, they tend to be weak unless we actually target them and learn how to activate them and train them to be strong. So as a physical therapist, we like to teach people how to do that. Or again, if you're doing Pilates, a Pilates practitioner will teach you how to activate those core muscles to get them to be to create stability in your body, so that your bigger muscle, the more external muscles on top, when you move, the bigger muscles tend to be movers. And so people can be very, very strong in their movers generally, and still be very weak in their core. So we want to look at that specifically, because just because you're strong on the outside doesn't mean that inside the abdominal muscles, your rotator cuff in your shoulder, your stabilizers in your hips, little rotators, your glutes, all of those muscles. What our bodies do is we want to be efficient, so we will use any muscle in our body that we can. If it's a stronger muscle, we will try to use that muscle to produce the required action. A lot of times there's a stronger external muscle that may assist certain motions, and a lot of times we'll use those muscles instead of using the ones that are supposed to work. So when you have an imbalance like that, when you're weaker in a muscle and stronger in another, and it's easier to use one muscle versus another, what tends to happen is we will keep using the muscle we're not supposed to. Again, over time, it doesn't always cause a problem, but a lot of times it does over time cause a huge issue, and it may turn into an overuse injury, a chronic injury. It can lead to all sorts of problems on the nerves. And again, when we get these injuries, it just kind of spreads out and it escalates. Again, you might have a little problem somewhere, and if you don't address it, then it can get bigger over time. So moral of the story is that if you can find someone to help you figure out what your imbalances are in your body, then you will, that's the hardest part, to figure out what are your strengths and weaknesses, where are you tighter than you're supposed to be, maybe shortened in a certain area, maybe you have too much movement somewhere, and you in particular need more stability, then that's what we can help people figure out in their bodies, and tap into the right muscles, do the movements right. And over time, once you get this, it becomes more natural. The muscles get stronger and you move more efficiently. It's not quite as much work. And I promise you, if you do take the time, because it does take time to address these issues over time, we can get rid of the pain. Like I said, sometimes that gets remedied quickly with rehab, and hopefully that happens. But the cause of the issue generally takes quite a bit longer, and it takes dedication and patience, and just doing what you can to optimize your movement and target those muscles over time. And if you find the right practitioner to help you with that, it's a great thing. So I hope this was helpful for everyone. Again, it was more breaking down certain components, common things I see in the spine, just to give you an idea of what you might encounter if you were to see me or another practitioner who does a similar method. What we would be looking at. Again, we don't just hand out things to you. We try to figure out what you need in your body, and give you those. And then, of course, for health and wellness, we would be just giving you that plus overall just your entire body. So not just the spine. We would look at your arms, your legs, everything, just to get you moving in the proper way to prevent injury and keep you nice and strong and stable, and so that it protects your body from further issues in the future. Thank you very much.